there, Megan Jansen with Employee Wellness Solutions Network. I'm so excited to have with me today Lianne Clarke and Noel McKay from Cowan Insurance Group. Hi guys, great to have you on today.
Hi Megan.
Lianne, you are the Senior Benefits Consultant and you're also working on the Corporate Health Initiative. Lianne, you've been working in this wellness space for a long time, 20 years to be exact. What historically have you seen as obstacles in employers developing a wellness strategy, and also what improvements have you seen?
Well, I would say over 20 plus years, the biggest obstacle has been ROI. So when you're in front of an employer and senior leaders and they're responsible for the budget, they want to know what's the return on investment. And that has been lacking in Canada. And it's funny because I was at a conference in the US a couple of years ago, and there are a few really large employers that got up there to talk about their wellness program. And they have the ability to calculate ROI. And they said in that meeting that they don't worry about ROI, they look at value of investing. And one company actually spoke to the VOC, the value of caring. So some of these bigger employers that have been doing wellness for a long time have understood the connection between employee health and productivity and wellness. And so I think in Canada, we're starting in the last couple of years to see that needle move. And more employers are understanding that connection. And I hear more employers talk about the value of investing and wanting to see, improvements in employee survey results. They want to see participation and not necessarily worrying about the ROI before they invest. They just know that it makes good sense. So that's the biggest change I've seen. And prior to that, that was the biggest obstacle.
I love that. Employers are definitely wanting that ROI, but having the focus on value and caring, it's inevitable that the actual return on investment would happen as well by focusing in on some of those more popular ways of thinking about what wellness does for a workplace. Thanks so much. Noel, so you're Director of National Benefits Consulting. What are you seeing as the biggest cost drivers for employee benefit programs? And really, how does that corporate health and well-being play in parts of those conversations with your clients?
So there's two things today driving costs and of concern. It's the drug spend in total, and long-term disability in the last year or so has caught right up with the drug spend as being a big concern, and they go hand in hand. The drug spend is often a predictor of LTD or short-term disability usage, and depending on the group, we're seeing mental health as being a huge driver on both of those, and they both fit into the drug spend on mental health and the disability costs of mental health definitely both fit into the corporate health space.
That's really great. Looking at that prevention as well, I'm sure also plays into that, is if a wellness promotion-based program is involved, then that can also be beneficial in helping steer some of those higher costs and higher drug spends for sure. Lianne, when talking to your clients about developing a corporate health and well-being strategy, what are the best practices that you'd recommend?
Well, really it starts at the top. So you have to have that senior leadership buy-in. You have to have a leader that's going to walk the talk, that's going to show a commitment to developing a culture of well-being in their organization. And so that typically involves some budget and some resourcing. So if you don't have a senior leadership team who are on board, I think it's going to be definitely a challenge in order to create a culture of well-being in the organization. So I say definitely starts at the top. From there, you want to look at your data. I find employers that just kind of grab at, let's do a flu clinic or let's, run a smoking cessation program without having looked at their data aren't going to see the uptake in the program that they're hoping for. So I recommend that employers look at their data, and that can be their disability data, their drug data, their paramedical data, workers' comp data. If they have it, employee engagement scores, any leading indicators of health, so health risk assessment, biometric screening clinic data. So as much data as you can get to look at where are the organizational health risks. And from there, I would say asking employees what they want. So an employee survey is a good idea, or if you have those questions already in your employee survey results, that's great. Otherwise, do a wellness survey. And then creating a committee. And HR is pretty much inundated these days. So involve people in the organization. And it needs to be a cross-section of employees from frontline to leaders. And these are people that will volunteer their time because they're passionate about health and well-being. So make sure you get that committee together. I recommend putting a brand, a logo, and name to the well-being program so that when you're communicating with employees, they've got that recognition, okay, this is our wellness program or our well-being program. I've had some clients start that with a contest. So they push it out to their employees and say, okay, come up with a brand and a logo, and the top 3 go, you get a prize, or they go in a draw for a prize. So that's a great way to kick it off. Then you've got to have your planning. So put a plan together with your budget and your resources. Do your rollout and communicate. And that's one of the biggest things. There's so many companies that have little pieces of a well-being program, but employees don't know what's available because they're never told. So it's not just putting it on a company intranet. Most employees need to hear things 7 times in 3 different ways. So whether it's your intranet, an in-person meeting, email, posters, just make sure you're getting the word out there and you're continuing to communicate. From there, you want to make sure you're measuring. So understand what it is you're trying to measure. Are you looking at employee engagement? Are you looking at that you want to see a reduction in your disability claims? Do you want to see an improvement in employee survey results? So figure out what it is you're wanting to measure as success for your company and make sure you measure it and then tweak as you go. I find you want to think long term, and I think that's one of the biggest changes for employers. They've wanted to have that check the box and kind of roll something out and, oh, I did it. But to really create a culture of well-being and ingrain that in the DNA of the company, you have to think long term. So 3 to 5 year strategy, you need to tweak as you go, continue to make it fresh and get employees excited about it. So I would say those are the best practices.
That's great. And having that really all-encompassing well-being program that includes senior leadership support, a cross-section for a wellness champion network or a wellness committee, as you said, having a strategic plan and rolling that out and having those cheerleaders help along the way, and then measuring for just to ensure that you're hitting some of those objectives and goals. So well said. I really enjoyed listening to that. Noel, back to you. I'd like to talk to you about our workplaces are aging. We're sitting longer. There's more chronic disease. There's more costs. And it continues to put pressure on the sustainability of group benefit plans. How, and is there a way to bend the curve on these costs?
Thanks for giving me the aging question. Being the 60-plus guy in the room, definitely the worn-out boomer. My cohort has not done a great job of taking care of themselves, and odds are, if you're over the age of 40, you're on at least 1 chronic disease maintenance med, and if not 3 or 4 of them. So it was interesting. I was doing a review with a client the other day, and surprisingly, their second highest category for long-term disability claims was cardiovascular. So heart attacks, blood pressure complications, and all that sort of stuff, which is a chronic disease. And in the past with this client, we had looked at their fully allocated costs of diabetics. So not only the diabetes meds they were on, but the cholesterol meds, the hypertension meds, and the mental health meds, on what that was costing the organization. Now we were able to bring in the long-term disability costs associated with those. So now we're getting a really big picture view of what chronic disease is costing the organization. And so I point blank looked at the client and said, so now what are you going to do? We know this is costing you a lot of money. We can only shift so many things back to the employee to pay through co-pays, making plan design changes, taking things out of the plan. At the end of the day, when all the shifts have piled up, what are you going to do? And the only thing you can do is prevent it. And you have to start working on that prevention. So it's, you know, to Lianne's point, where a lot of HR people or people in the corporate health space, they want fast results. It's not going to happen. You know, you have to take a long view of it, that if I start something today, eventually, if you have faith in it, I am going to get results. And so that's where on the chronic disease spend, you know, we can change it. We can bend the curve. On some of the other big drug spending, on the biologics or, you know, the autoimmune disease and stuff, there's nothing an employer can really do about it. You know, it happens. Someone just unfortunately gets one of those diseases, but the other stuff, they can work on it. And unfortunately, we're seeing chronic disease maintenance medications showing up in younger and younger age bands all the time. It's just not the aging workforce. It's the workforce that's coming in that is starting to display these things. So it's long term. If you want to bend the curve or ratchet the inflation slope down, you have to start doing these things. You have to find a way to get rid of the need altogether, even if that's possible. But if you do nothing, then it's just going to keep escalating. So you have to have faith that if you do something, you do an intervention, you put something in place, in the long term, it will produce the results you want.
Very well said. And I think it's frustrating for some professionals in our space that have that quick fix approach, and they really want to see it. As you said, both you and Lianne mentioned, is that that's what people want, but that's not how it happens. There really does have to be a culture shift. And it does start with employees choosing correctly, improving awareness and education on how they can make the right choices for them. And if we can have a really encompassing culture to help support that prevention and promotion of healthy behaviors, it's only going to help in the long run. I think we touched on a lot of great things today. Are there any last thoughts that either of you would like to share as we wrap today up?
But I want to build on your comment about culture. Corporate health, wellness, it's not a standalone. It's part of the culture. So if you want to be an employer of choice, and I think Lianne, you said that early, that's my culture, then the caring and having these things in place is all part of a culture, and you're going to get the positive results out of a positive culture, and this has to be in it.
Definitely. Yep, I echo Noel's comments on that, and just that, to your point as well, you can only do so much with plan design. Employers need to get on board with investing in the health of their employees. And investing does mean a little bit of money. It doesn't have to be a lot of money, but it does mean putting a little bit of money and effort into it.
Well said. Noel McKay, Lianne Clarke, thank you so much for your insights today. It was really great to have you on. Thanks so much.
Thank you.
Our pleasure.
See you later.